Lori Hacker, or best known as Lolo, was only 10 years old when she was diagnosed with acute myelocytic leukemia and almost 14 when the cancer came back for the second time. Her unstoppable determination, the support of her family, friends, and donors, along with her strong desire to live, helped her to defeat the cancer and became an inspirational figure for many children with the same conditions. A lot of research and other activities are essential to help to improve the lives of many children during and after the treatment against acute myelocytic leukemia. Despite of being the second most aggressive and deadly cancer for children, it remains as one of the least founded compared to other types of cancer. Along with an interview conducted to the founder and president of Los Angeles, we investigate the history of the foundation, the activities they perform, and their involvement in the community. Also, we did a deep research about acute myelocytic leukemia and the effects that it has on the patient. Today, we will discuss the need for support that Los Angeles require in order to continue sponsoring the activities reaching their mission. By providing you with knowledge about the background of pediatric cancer and acute myelocytic leukemia, provide information on Los Angeles and why they should be supported, and show you how donating to this cause helps to save many lives.
First, let's talk about what cancer and acute myeloid leukemia are. Leukemia is a cancer in which abnormal white blood cells are produced in the blood or bone marrow, making it difficult for blood cells to prevent infection from occurring, carrying oxygen, and causing blood clots. More specifically, acute myeloid leukemia, or AML, is a quickly progressing blood cancer. According to the Dana-Farber Cancer Institution website, it is not known what causes leukemia. However, in the majority of childhood leukemias, gene mutations and chromosomes abnormalities in the leukemia cells occur sporadically. Symptoms include but are not limited to anemia, bleeding and or bruising easily, recurrent infections, bone and joint pain, as well as abdominal pain. Treatment for this cancer takes a toll on every child. According to the Dana-Farber Cancer Institution website, treatment usually begins by addressing the child's symptoms, such as anemia, bruising, etc. And in addition, treatment may include chemotherapy, stem cell transplants, blood transfusions, and other aggressive medications. According to the Leukemia and Lymphoma Society official website, some side effects of cancer treatment, such as fatigue, can linger for months or years after therapy. Some medical conditions like heart disease and other cancers may not appear until years after treatment ends. This shows why it's so important to have more effective treatments, as thousands of children go through a very aggressive treatment only for other diseases and or side effects to take over their lives. Pediatric cancer is grossly underfunded, not allowing for any improvement in the treatment of patients in the last 40 years. According to our interview with Leslie Hacker, founder of Lolo's Angels, despite there being many organizations that help families pay medical bills, very few organizations are helping fund pediatric cancer research. In fact, according to the World Herald Organization website accessed on April 3, 2020, despite the efforts of many organizations to help address pediatric cancer, an estimate of 300,000 new cases affect children every year around the world. This mainly happens because donations and funding often goes to support organizations that help with treatment at an individual level. Further, according to our interview with Leslie Hacker, many organizations don't actually help children. One example is the Leukemia and Lymphoma Society, which only gives 4 cents out of every dollar to pediatrics, and the American Cancer Society only gives 2 cents. Not knowing how important research is takes away the opportunity to make big changes that could improve the lives of many. Prioritizing research is something that is not seen as important for many organizations. But Lolo's Angels is an organization that is more than focused on one aspect of pediatric cancer. It tries to address an important aspect that many organizations leave out, which is the research needed to find effective treatment. Now that you know what AML is and why research is important, let's talk about what Lolo's Angels stand for and what they do.
Los Angeles was founded in August 2016 and all started after her daughter Lauren, or Lolo, was diagnosed with acute myelocytic leukemia. According to Los Angeles official website, accessed April 3, 2020, cancer survivor Lauren Hacker needed 36 units of blood and 39 units of platelets during her leukemia treatments. Blood products were available to meet her critical needs thanks to many volunteer blood donors. The idea behind the name of Los Angeles is as simply as having someone on your side, a friend, a family member, or an unknown hero during this hard process. Among many organizations that help pediatric cancer patients, Lolo's Angels is one of the few that focuses on helping in a variety of ways. Those activities include sponsoring research past pediatric cancer, conducting bone marrow and blood donations, and toy drives. Lolo's Angels always strive to donate the most into research, while at the same time trying to adjust their budget and what they have so none of their activities get affected. There are many ways a person can help to support Lolo's Angels cause and mission, either by donating money through their official website, participating in blood and bone marrow drives, or sharing your time as a volunteer. You will be making a huge difference by becoming the next angel in someone's life. Well, now that you know more about what Lolo's Angels is, let's talk about why you should support this organization.
Whether society decides to help fund research for pediatric cancers can determine if more effective and less invasive life-saving treatment is ever found. With the help that Lolo's Angels organization has received so far, it has been able to achieve many great things. According to our interview with the founder of the organization, Leslie Hacker, they have now donated over $150,000 to research, run blood drives locally, and have run 57 bone marrow drives. Along with that, they've also donated over $25,000 worth of toys and games to Children's Hospital and have been instrumental in pediatric cancer awareness in Nebraska. Without the help of the community, Lolo's Angels would not have been able to accomplish what they have so far. According to Lolo's Angels' official website, over 80% of AML cases are diagnosed in adults over 60, so most research is focused on seniors, and for this reason, Lolo's Angels is the way to go, as their main goal is to make a difference by getting better comprehensive treatment for kids that also will not make them ill for the rest of their lives. Also, during the interview, Ms. Hacker expressed their urgent need and desire to fund a survivorship clinic at Children's Hospital at Omaha. The organization's biggest concern is that the longer it takes to fund this program, the longer the kids that have recovered from cancer will have to wait to have the resources they need to reclaim their lives. If research is not adequately funded, we will be unable to develop safe and effective methods to prevent, detect, diagnose, treat, and ultimately cure the disease we call cancer.
In conclusion, today we talk about pediatric cancer, more specifically about acute myelocytic leukemia, what Los Angels stands for and what they do, and why they should be supported. By learning about this disease and supporting this organization, we can help to save the lives of thousands of children. In the end, we hope that you learn about ways that you can help to address pediatric cancer with the help of this organization. By taking part in this organization, we can help to take a stand against pediatric leukemia and come one step closer to find a cure. Thank you. Do you have any questions?